Good afternoon, everybody. My name is Barry Hudson. I'm the Director of Public Information for Montgomery County, and welcome to County Executive Marc Elrich's weekly press briefing. We'll get started in a moment, but reporters, please make sure that you ask for permission to record if you have not received it already. If you do have questions, please list them in the chat and also list your news organization. Joining us today, as always, is County Executive Marc Elrich, Dr. James Bridgers, Dr. Earl Stoddard, and we're also joined by Sean O'Donnell from our Department of Health and Human Services. So without further ado, I will turn it over to County Executive Marc Elrich for his opening remarks. County Executive.
So thank you all for joining me today for the weekly media briefing and season's greetings to everyone. With many families planning to celebrate the holidays this week with larger gatherings and more traveling, we're worried about the potential of the massive outbreak that could put further strain on our hospitals and our healthcare systems. It is important for everyone to be aware of what's going on and think hard about any plans that involve larger crowded indoor gatherings, particularly ones where people aren't masked and or aren't vaccinated, and where you'll all be breathing the same air for a long period of time. The CDC and other public health experts are asking the people do not host or attend gatherings if you're sick or have symptoms, and do not travel unless you're fully vaccinated. This is not just a Montgomery County problem. I think we're all pretty aware this is a national, international crisis right now, not particular to us. The cyber attack on the state's data dashboard at the beginning of the month has left us without statewide or local test positivity and case rates now for almost 3 weeks. While we have some statewide data, we're still waiting for comprehensive county level data. Maryland is reporting a positivity rate of over 11%, which is the highest it's been since the spring of 2020. And the data from our county testing sites shows positivity rates of over 10%. This does not include test results from our private sector partners, of which there are many. The Omicron strain is showing up in 73% of new COVID cases nationally, according to the CDC. That's a jump that no one expected. But the state of Maryland has not directed the testing companies to determine the variant that we're seeing here, whether it's the older Delta or the newer Omicron. I spoke to the owner of one of those companies who does the majority of testing in the county for the county, and they were concerned that as of a week ago, the state still hadn't requested samples of county tests so they could be analyzed to determine the variant. Having this information would be really helpful. COVID numbers are 10% higher than a week ago, and nearly 80% of the country's intensive care beds are already full, with COVID-19 patients in 1 of 5 of those beds, according to data from the U.S. Department of Health and Human Services. Governor Hogan noted this past Sunday that this is, quote, probably the worst surge we've seen in our hospitals throughout the entire crisis, unquote. And I think some of you remember how worried the state was back when these numbers were lower than this, but pretty close. Unfortunately, or unfortunately, on Monday, he announced himself that he had COVID, and we also learned that Baltimore County Executive Johnny Olszewski tested positive as well. Our wishes for mild symptoms for both of them and a speedy recovery go out to them and everyone who has contracted COVID recently. Just in the last hour, we heard that Mayor Bowser announced a vaccine mandate for the district's businesses, not all of them, but essentially the same ones that I had suggested. And this is an issue that I raised back in the summer, not to mention that I've been raising for the last couple of months, trying to encourage a regional approach. Hopefully the council will act now to follow the district's lead. Her program will begin on January 15th. We should do the same. Both Governor Hogan and County Executive Olszewski were fully vaccinated and boosted, showing that we have to continue to expect breakthrough cases. But the top concern is our hospitalization rates. Only 9% of unvaccinated Marylanders are responsible for 75% of our COVID hospitalizations. 9% of unvaccinated Marylanders, 75% of COVID-19 hospitalizations. That's an absurd number, and it shows the tremendous importance of vaccination. And you can see the charts on the screen. I'll be right back. Bear with me a second. Posting this has knocked out my other screen. Okay. Okay, I thought this chart from the New York Times that was brought to my attention by Seventh State this morning was important to share. Nationally, the unvaccinated are 5 times as high as the fully vaccinated currently when it comes to daily cases, and are 13 times higher in terms of dying from COVID. Vaccination was not a tool in our toolkit last year, but it is now, and our best defense against the virus, particularly against protecting against severe infections, is to get vaccinated. Today, the CDC is reporting Montgomery County is 82.7% fully vaccinated. Fully vaccinated now defined as 2 doses, hopefully soon to be defined by 3 doses. It is good to see that many in our community are taking this latest surge seriously. We've administered over 311,000 boosters to our adult population, yet we still have over 50% of our eligible vaccinated residents who have not taken their boosters. Evidence is showing that the boosters are even more important with Omicron. I've asked HHS to go through our lists of folks who we have vaccinated and to send emails or correspond them any way we can to encourage them to get the boosters. Dr. Bridgers will go more into this map that shows zip code by zip code data and where we need to focus our booster messaging and outreach. I'm also really concerned about the 43,000 residents who are 65 and older. This is a group that led the way to getting vaccinated in the beginning, and we hope that they are getting this message and will come in and get their vaccinations now. They still need boosters, and we're going to be doing everything we can to extend outreach into that community. Last weekend, we took booster shots to the people, hosted our first Boosterama at Westfield Wheaton, and it worked extremely well. We got the word out about the event and about the importance of getting a booster shot, and our residents answered the call. 100 people were in line before we opened, and eventually we had to bring more doses from our facility at Dennis Avenue in order to meet the demand that was at the shopping center that day. By the end of the day, we had boosted and provided first doses to 420 attendees. As a result of the success of this clinic, we're planning our next Boosterama, as well as other pop-up clinics in targeted communities. We've also seen how a 3-fold increase in testing at our county COVID test sites compares to just a month ago in November. We are recommending making appointments online since walk-up opportunities are limited. We also know there's high demand for rapid tests, and those supplies continue to be limited. We are still waiting for our order to come in, and we're continuing to look for additional supply. As far as school goes, one of our biggest concerns of the surge is the impact on our schools and children. Our HHS department is working in concert with MCPS to find the right balance between keeping our kids safe and healthy while keeping in-class learning as intact as possible after the holiday break. Let me be clear, we're not going to be putting our children at more risk to be in school than they would be out in the community in general, but it's wise to concurrently limit extracurricular activities. And I want to thank and support Dr. Bridgers and Dr. McKnight for making these recommendations and decisions. Since we know that COVID is basically a person-to-person spread disease, it makes a lot of sense to focus our educational efforts on the essentials that we need these kids to be able to keep pace with, and pass on some of the other opportunities, while helpful and things I know that people enjoy, simply extend the opportunities for kids to come in contact with each other. We're not at the point we should be maximizing contact. What we need to do is make sure that we don't have so much contact that we jeopardize our ability to keep the schools open. We're going to do everything in our power to continue in-class learning. The rates of learning loss that occurred when schools were virtual, especially on lower income minority families, was heartbreaking. Additionally, for many families, losing out on school resources that schools provide, such as daily lunches, as well as the economic impacts for parents who can't work from home to monitor children, is something that we all must work to avoid through some very tough weeks ahead. We don't want parents giving up work to have to stay home with the kids, and we don't want parents going to work and leaving their children home alone. Neither of those is preferable to keeping our kids in school. As soon as schools go into their winter break, MCPS and HHS will continue to keep our parents, students, teachers, and school employees aware of any changes or updates through the holiday break. And we're hoping and asking the families and parents of MCPS students also help keep other students safe by getting their children tested and vaccinated before they return to school. Over 50% of our 5 to 11-year-old population is still not vaccinated. We've got the doses, we've got the staffing that can execute on this. We just need to get the children in line so we can give them their shots. As you can see from this chart, we have fully vaccinated 44,000 pediatric first doses and have just under 30,000 kids fully vaccinated. Finally, as many will enjoy families and festivities this holiday weekend, I want to encourage everyone to support and help out the thousands of our neighbors, friends, and even strangers who are in a tough spot economically, dealing with stress and the many mental health challenges, or who are just down on their luck. This week, I joined my granddaughter at a food and coat distribution event in Tacoma Park at the Tacoma Park Co-op called Small Things Matter. As you can see from this picture, the people waiting to be assisted went all the way down the street. Say something about how proud you are, everybody, of the folks in this community who stood out and spent their time yesterday afternoon passing out essentials to these families. It was a really amazing thing just to see the kids coming up to the table. I was working the toy desk, and just incredible to see what the look on children's faces as they got toys, and the happiness in the parents who knew they could at least give their kids something. And it's heartbreaking to think of people not being able to provide even the basic things for their kids at a time when we're going to be hyper aware of all the other gifts and the whole tradition of giving that we have, and that some kids won't experience that. I can't count the amount of food and toys and amenities we gave away and we've given away throughout the county over the past 22 months. But there's one consistent community character about Montgomery County, and that's our compassion. We're united as a community. We're empowered by our diversity and always willing to go and reach out and assist our neighbors and uplift strangers. I'm very lucky that I get to see the good in our people, that Montgomery County is full of people who are basically humanitarians. Thank you for joining me today, and I'm now going to turn this over to Dr. Bridgers, Dr. Stoddard, and Sean O'Donnell for their updates.
Thank you, Mr. Elrich. Happy to join you this afternoon for another press conference. Season's greeting to all. Just a couple of points before Mr. O'Donnell goes into our pulse report and provides more descriptive data regarding our case counts, hospitalizations, test positivity, and follow-up. I wanted to just circle back and provide an additional update to the press conference that I participated in with Dr. McKnight and MCPS on Monday. We are continuing to assess their outbreak data. We submitted recommendations for a layered preventative measures, as Mr. Elrich indicated. Our goal is to keep students in school versus a virtual learning. We have a layered protection plan, protective plan based on data with the high risk activities such as basketball, wrestling, track, gymnastics, etc. So we use that data as a basis of assumption to identify those teams, to get them quarantined and out of population. We further looked at those extracurricular activities, and we had conversations with MCPS yesterday and our communicable disease and epidemiology team yesterday to further assess those data. We know that there have been some challenges versus sports versus those non-sports related event, but plainly put, we need to pause all activities during the winter break so that we can identify those outbreaks. Some of those outbreaks were with, as Mr. Elrich indicated, those students who were fully vaccinated, who were masked. And so we need to look at the data to assess how the community level transmission is being spread. Mr. Elrich also asked us prior to any of the Omicron spread coming to the East Coast that we request sequencing for that particular emergent strain. And we've done that prior to the state moving to I believe all of the specimens now being sequenced. And so we will continue to look at the data as we do daily over the winter break to assess where these items will be, where these extracurricular or high-risk activities will be when they are scheduled to return at the end of, on the week of January the 7th, I should say. So we're looking at those. We're also considering, it's very important for students to know their status when they return to school. So we've been working with the Maryland Department of Health, and we'll continue to work with MCPS to identify mass testing venues within the school system. We know that we did this prior to students actually returning to school in the fall, and we are returning to that. Testing is key for our students to know their status so that they, the teachers themselves, educators and staff, can continue to flourish in a safe and virus-free environment as best as they can. So we will be working with MDH and their K through 12 testing team to test and to also have those results resulted in the Cyan Lab, which has a contract principally with the Maryland Department of Health. We also encourage all students to get tested before returning to schools. Now, our testing spaces in the county have seen an enormous increase, and Mr. O'Donnell will share some of that data with you. But there are other spaces in the county to get a COVID test, and we encourage all to get a test if you're traveling out of town, and Mr. O'Donnell will speak to this as well. The key is to get tested and know your status. Even if you don't feel sick, if you've been in close contact, or if you've been in those high density areas, or those areas where folks are indoor and out of your household, you know, it's very good, wise healthcare to know your status. The last piece I'd like to share is that Mr. Elrich has directed our public health and epidemiology team to do a deeper dive, as he indicated, into getting more folks their booster shots. We've run some preliminary analysis, Mr. O'Donnell and his team, and we've identified those zip codes where we want to send emails to, encouraging and reminding folks that they had come upon that period that they are now eligible for boosters. And those zip codes are based on preliminary analysis and may change as we receive more data feeds, but they are 20903, 20912, 20851, 20901, 20850, and 20851. Now 20886 is also a zip code of consideration, as well as 20852. But these are zip codes where we see great disparities in our racial ethnic populations, and we need to give folks boosters. So I will stop there and turn it over to Mr. O'Donnell to run us through the Pulse Report.
Thank you very much, Dr. Bridgers. All right, you should all be able to see the slideshow we have up of our latest Hhs Pulse Report. And I'd just like to start with one of the most meaningful statistics that we are tracking, which is our hospitalization rates. We are at 205 COVID diagnosed patients in our Montgomery County hospitals. 75 of those are at the alternate care site at Tacoma Park Adventist. And that is more than a third of the cases in our county. They do have a finite number of beds at the site, although we've been in discussion with them about the possibility of expanding that capacity. Again, we're currently with our hospitals. They have not yet begun to restrict other procedures at the hospitals. I know that sometimes it's a little bit of a misnomer to refer to those procedures as non-essential procedures. And so they are trying to avoid moving to that determination, but that is something that has been done in the past. And the state does provide direction to the hospitals across Maryland when they feel that that is necessary to limit hospital beds to patients that are there for COVID or other essential needs. So in talking about Omicron, we are aware now that Omicron is the most widely identified cause of COVID currently in the United States. I believe that the number of states and countries is probably updated since we last put this together, but it continues to move very quickly. The protective measures against Omicron are the same as we've been recommending for all of the other variants before in the original COVID. Obviously, at this time, with a highly vaccinated population in Montgomery County, we are strongly recommending booster doses for individuals who are 16 years and older and have met the time requirement to receive a booster. What we've seen with the boosters uptake across the state of Maryland is that our older populations are much more likely to have received a booster, and our younger populations have come out in decreasing numbers. And so again, we're not just recommending our seniors to get it, although those are who are at the greatest risk. We're recommending everyone who is eligible for a booster to get one. We're continuing to strongly encourage mask usage. Having 2 doses of a vaccination, even a booster, is not the only way to prevent the spread of the virus. Wearing masks and social distancing and good hygiene are all part of that. The CDC has updated international travel requirements. Of course, now for international travel, there is requirements to produce negative COVID tests. And they also recommend COVID tests after arrival, as well as quarantine for unvaccinated travelers. Anybody who's traveling, which probably is a much larger number within our county, the recommendation is that if CDC, first of all, recommends that unvaccinated individuals should delay travel if you're not fully vaccinated. If you're not fully vaccinated and you must travel, we are recommending to get tested both before and after your trip. And anybody who's returning from an area with significant transmission is recommended to get testing upon return. Of course, that now includes our county. And we are strongly encouraging people to not travel if they've been exposed to COVID-19 unless they're fully vaccinated or have recovered in the last 90 days. If they're currently sick, if they've tested positive and haven't completed their isolation period, or if they're awaiting results of a COVID-19 test and they're not sure of their status. So I know the county executive has covered where we are with the vaccinations. These continue to increase in our fully vaccinated level. We're just reminding our media partners that the CDC is now capping the official vaccination rate at 95%. We do know that the current track total of first doses is higher than that percentage, but we'll report this the same way the CDC is reporting it. The county sites, I'm sure many of you have heard, we've had a huge increase, not just at county sites, but at private testing sites. Our sites have encountered a huge increase in demand. We have worked very hard to try to increase the volume of testing we can provide. We are now warning people that walk-ins may be turned away at a number of sites if we cannot handle them. We want people to know that before coming out. We are trying to handle as many as we can, but in order to make sure that our sites are safe and we're not inappropriately gathering large groups of people. And again, we're trying to avoid extensive wait times for those that have appointments. We may be turning away some walk-ins. In the past, over the past week, we've seen an increase of 85% at county testing sites alone. Our test positivity is now up to on a rolling 7-day average is now up to 10.59%. One thing that we're sharing is before we lost the total figures across the county, including private providers, we had noted that county testing sites were showing a slightly higher positivity rate than private provider sites. It's possible there's more employee testing occurring at other sites, and that we may be seeing a higher number of symptomatic individuals at county sites, but we're just letting you know that we are looking forward to getting countywide data back. The state system, the state is reporting that more and more providers are included in their system, but they have not provided us a total case count or case rate yet. But we are seeing a huge increase at our sites. We're trying to accommodate as many as we can. We know people want to be tested before traveling. One thing we're strongly recommending is there are a lot of providers offering testing outside of the county. Historically, we were less than 10% of the total county available testing. I'm sure that that percentage has gone up with the surge of what we've offered, but we also know our private partners are surging as well. So we remind people there are other locations to get testing, and we are hearing reports that even rapid tests are available at pharmacies. It's not easy to find them. We understand that, but they are continuing to get them in and sell them as well. Vaccinations, we continue to see a really high demand for boosters, and we're happy to see that. We're working to get as many boosters out as we can. Again, the private community is offering quite a bit of availability of boosters as well. And we continue to do our pediatric clinics. Those have been running from 4:30 to 7. We know over the next week or so, many children will be off from school and their parents may be home with them. And so we're hoping that a higher number of those parents and 5 to 11-year-olds can come out and get their first and second dose. This is the best way to protect those kids who are not fully vaccinated yet. So I think we've touched on this briefly. Within the county, the report from the state is that we are on the verge of hitting 300,000 additional doses given out in Montgomery County. Again, we know our state numbers don't include individuals who receive a vaccination outside of the state of Maryland. And we know historically up to 10% of our population has gone to the district or Virginia where they work or where they're visiting and gotten vaccinations that way. So I strongly suspect that we are at a higher number here with boosters. But we're still, we're waiting until we have full restoration of all those figures to give an official count. But we just wanted to keep you updated that we're moving in the right direction. But as the county executive mentioned, there's still a lot of people who qualify for boosters who have not gotten it yet. Our pediatric doses, I know this was already shared. Again, we're working to get this number higher. This is still the lowest percentage of our population who's eligible to be vaccinated, who are vaccinated, obviously because they're the most recently eligible, but we're continuing to emphasize and try to get out as many 5 to 11-year-olds as we can. And then just to touch on finally, the rapid tests. I know this is something that have been distributed through the state and has been talked about. We have ordered some rapid tests from Abbott. We've ordered quite a lot. The only ones that have come in so far have been the clinically administered rapid tests. We have distributed those out through partners and using them as well. So far, we've distributed a total of 23,000 of the rapid tests, including both the over-the-counter or take-home versions, as well as the clinical versions. And I just wanted to give you a brief snapshot of how we've distributed those. As we mentioned previously, we're trying to focus those on individuals with increased risk or challenges getting to a testing site or have been disproportionately affected by COVID, especially recently. And so we've at this point distributed over 15,000 rapid take-home tests, and actually the remainder have been allocated to our outbreak support team, as well as adult medical daycare. We are waiting for some additional supplies coming in from the state, but we'll be distributing these shortly. The partners we've done it through have been our traditional partners who are doing community testing and providing community services as safety net partners, and work with populations, again, that have more challenges getting to traditional testing sites. We've distributed 2,000 out through the hub sites, and we've done specific outreach to our in and out patient behavioral health community, our IDD providers, and when we do homebound visits, we distribute rapid test kits out to them. We have distributed previously. We've distributed a significant number out through our county test sites. That has been reduced as we've been able to distribute out through other partners. And again, at this point, we have allocated all the ones that have come into the county. So those were the updates I have. I know there'll be questions, but I'd like to turn it over to Dr. Stoddard now for updates.
Good afternoon. I just have a couple additional things I wanted to talk about. So as touching on, first I want to recognize that the FDA obviously just earlier this about an hour ago approved Paxlovid for an emergency use authorization, which is the Pfizer anti-COVID pill that they've shown does reduce both hospitalizations and risk of death. And so obviously that's a new additional tool in the toolbox. It will require, there's not nearly enough of it for all the COVID cases that we are seeing right now, which is a part of the problem, but obviously this authorization will allow for Pfizer to continue to expand its production. The other drug I know is molnupiravir. Molnupiravir is Merck's pill. It's actually, I think, shown to be, I don't want to say it's better, but certainly some of the data looks very promising with that one as well. And they're expected to, I think they're before the FDA as well later today. So hopefully we'll see that come through. Those two pills in combination with the other resources we have available will be significant additional new tools to combat COVID-19. And we're looking forward to having some of those be here in Montgomery County. I did want to mention briefly Test to Stay. We've gotten a lot of questions about that. Obviously with the state, with the CDC supporting Test to Stay, with the state obviously showing increased interest, including with the governor announcing $30 million yesterday. Obviously, we're the only jurisdiction in the state of Maryland that has thus far successfully implemented Test to Stay. We, as of I think end of last week, it was 7 schools and 240 schools or student classroom days saved as a result of Test to Stay. We are looking to bring in additional personnel in the coming new year with the January 3rd returns to students to school and being able to expand the Test to Stay program more broadly. But obviously, I think in thinking about the governor's provision of the resources, we've really not had limitations in terms of money. The limitations have often been the availability of personnel, as in people who are interested in doing this kind of testing are available and are ready to come on board rapidly. That's been the more limiting factor, is not the money to afford to do Test to Stay, it's the people and personnel needed to do it. The kits have not been a problem either. With the state has provided more than ample kits to do Test to Stay. It's really just the people to run the test and then be able to submit the data up through the state as required through the CRISP system. Last thing, obviously, we're obviously paying a lot of attention to DC's implementation of what's often referred to as a vaccine passport. Obviously, we'd gotten some heads up that they were going to announce this today to a degree. Not the details of it. So obviously, when we saw the details of it, we were actually looking at that, considering we've drafted language that we will provide to the county council for their consideration. Hopefully, they'll support a vaccine passport similarly in Montgomery County as is in DC, as the county executive has long advocated. But obviously, we've drafted language, and we're actually reviewing that language in light of DC's proposed model, as well as trying to address some of the questions that were raised by some of our business partners when this was originally proposed back in September, to make sure that in light of the changes that have come to COVID in the last 3 months and the questions they raised, whether we just may need to update the proposal a bit before we share it with the council for their consideration. And so those things are all in progress, but obviously we're paying a lot of attention to the increasing case totals, monitoring hospitalizations and other things. The other thing we're also focusing a lot on is understanding how the burden of COVID is going to impact county operations. And so we've seen a significant number of cases in our correctional facility amongst staff and inmates. We've seen a significant number of cases amongst our fire rescue staff, both vaccinated and unvaccinated. And we're obviously monitoring those conditions to make sure that we can continue to provide the services that our residents rely on. I think that's all I wanted to go through, and I think we're happy to answer questions at this point.
All right. Thank you, gentlemen. Our first question that we have is from Kate Ryan of WTOP.
There we go. Can you hear me?
Yes.
Okay, thank you so much. I appreciate it. Had some tech issues here. I did want to follow up on the DC action. And again, Dr. Stoddard, you're saying you want to look at it. What exactly would that take to make it happen? And why not? I think a lot of people go, why not do this? And what are the headaches that we may be imposing on businesses when we say, hey, guess what? Nobody gets in unless they have a passport.
For the county executive to say why not, I think we largely agree. It's why not do this, and so we're certainly going to talk to the council. It would require the council to act as the Board of Health to pass such a regulation. Obviously, the county executive has long been a supporter and advocate of this process, and the council has reasonably often pointed to regionality as a rationale for why we do or don't do things. And so obviously in this case, a significant regional partner has acted in this way. And I think that should help provide some support for us. The concern has always been, the concern raised by the council in previous conversations about this and by businesses as well, I shouldn't just put this on the council, is that would it harm businesses because people would go to the district or go somewhere else to go to restaurants or whatever. We never thought that was the case, but obviously now with another regional partner coming on board, it makes that less of a concern given how much, how many restaurants and other venues like that there are in the district. So we're really just, we actually wrote this draft legislation back in September. So we're just making sure we've got a 5 to 11-year-old vaccination that's now on board. We have boosters that are on board now. We want to make sure that the legislation considers our proposed draft legislation that council thinks through boosters and 5 to 11-year-old vaccinations moving forward. And so I think that's really what we're trying to make sure at this point. A number of questions were raised by the Restaurant Association, and to the extent that we can address some of their concerns about the operational implementation of this, we will reflect that in the proposed bill as well. And so I think that's all we're doing at this point. We're going to send it over to the council. I think the county executive has made that clear. But we want to make sure that we send over something that has considered some of the operational impacts that businesses may be concerned about.
Got it. And county executive, and do you know when you can get them? I know they said they'd be willing to come back before the recess ends. How soon do you think this might happen?
You're muted, county executive.
So I hope we have it in front of them when they come back. I'm concerned because I've heard this argument about, people might want to need here and they go someplace else. If you're in a county where almost all the adults are actually vaccinated, I'm not sure who is ever going to leave the county to go eat somewhere else. It wouldn't have had I don't believe for a second it would have had an effect on dining here other than maybe people from other counties. The thing that's kind of perversely humorous about this is now we're in a position that we would definitely want to do this because unvaccinated people in the district might find us as the place they would want to go, which would further put more of our restaurants at risk and more of our patrons at risk. So out of mutuality and making sure that we're all on the same playbook, there's a great logic for doing this in conjunction with the district. But it was always the right thing to do. Other people did it, before we did. We wouldn't have been the first place in the country to do it. And I think it's important. Although, contact tracing has always shown restaurants near the top of the list for places where people come in contact with people who've had COVID. It's just, we should have done it. Now we can do it. I hope we can do it.
Got it. And if I can follow up in terms of the access to testing, again, you've indicated that at county sites, for example, you may have to stop taking walk-ups if if you're full. Is there one central location? I know we're 2 years in, we all should have these, tattooed on our foreheads by now, but what's the best single point I can direct our listeners to go? If you're looking for a test, here's where you want to go. Because right now, I see it in the district as well. It seems to be a scramble from people racing to their libraries where they're doing it in DC, et cetera, et cetera. So what's the best guidance you can give me?
Well, Kate, honestly, if I give you one location and we send everyone there, we're going to swamp that one location. I do suggest going to our website, and the list of testing facilities and appointments are there. We try to have it at least a few days out to accommodate it. We'll be doing testing up through till tomorrow. We're going to take 3 days off around the holiday, and then we'll be back testing next week, Monday through Friday. And so a lot of opportunities, but I recommend going to our website. We also have a link there that will take you to search using the Maryland Department of Health engine, all the locations where people can be tested. So I do realize that any one location, public or private, would be overwhelmed if everyone went there.
Oh,
right
yeah,
now.
I wasn't asking. I didn't mean that. Like, do I go to Fifth Avenue? No, but what I meant was, website location, because again, are they going to end up going to county and then to the state and then, oh, I have to check my Walgreens? Or is there a focal point or
So again, yes, and I appreciate that they're pulling up the county site here. I suggest checking the county, checking the county site, checking the available appointments at county providers and our partner providers. And if you don't see appointments available there, then that next step would be to look through the state listing, try to find a location that is convenient to you, that location wise and time wise. I do realize it's a little more effort now than it was a few weeks ago. And I definitely empathize with people looking for testing. It's become a little more challenging, but these are ways to try to find it. And I think a large number of people have been successful kind of working through this process to find testing.
Sure, Sean. And just also let me add, Kate, let me just be clear. Our Dennis Avenue Health Center site is our smallest testing site and is not the primary site. I know it's been overwhelmed. In a sense, we have lines for symptomatic and asymptomatic. And so we want to keep all of our sites clinically safe. And so the larger high throughput sites are always more clinically safe as far as having the volume and seeing the volume. And it's cold outside. We don't want folks waiting out in line. Our Lake Forest site, in collaboration with our Maryland Department of Health contractors, will be moving inside. So that was a drive-through site. So we will have more space to accommodate a higher throughput. So as Sean indicated, please check our website for those testing spaces that are available so that you can determine the best site based on your location in the county and where they are available appointments and walk up.
Thank you. Thank you very much. Lastly, I know that Governor Hogan said National Guard would be deployed to help across the state. Do we foresee doing something like you did with the mass vaccination site, opening Germantown again for testing, for example?
Okay, we don't. Go ahead, Sean.
Let me actually say that's a good point. I just wanted to follow on. Yesterday, we had discussions with some of our community partners, and the results of this will be on our website as far as where appointments are. But we're working on, as Dr. Bridgers mentioned, Dennis Avenue is a very small, very active clinical site for other programs. We're working on moving testing to the Silver Spring Civic Building on days when we're there, in addition to vaccinations there, because that facility is a much bigger facility and can handle a higher throughput. Likewise, we're discussing with our partners at the rec department, doing some testing next week out at East County Rec Center, which would have an expanded ability next week to offer testing, because again, it's a bigger facility than what we have available at Montgomery College Rockville. So we are looking at trying to expand the spaces we're using to do more.
Thank you so much. I really do appreciate it.
Thank you, Kate. Next question is from Steve, Bethesda B. Steve?
Happy holidays, everyone. I wanted to, this vaccine passport kind of proposal. We talked a lot about indoor dining, but can you just give me a sense of, will this apply to all businesses? Is it restaurants, retail? I know you're probably still finalizing the language here, but what businesses would be applicable under this?
I've asked for it to focus on things like the dining, movie theaters, entertainment, and probably gyms. As long, because those are all places where we're tending to see masks come off. On the other hand, places like retail, when I've been in retail shops, for the most part, everybody is masked, both customers and people who work there. So if we can maintain that, and frankly, they're not as crowded as they used to be, because a lot of people are avoiding going into stores right now. Even now, they're not as bad as, I think this probably typically would have been. So my focus is on the place where you sit for an hour and you don't have a mask on, or you're exercising and exhaling without a mask on. All those to me are really much more problematic.
And you mentioned you don't believe the economic impact will be that much. I mean, I'm thinking of, the whole region. There's Frederick County, PG County, Northern Virginia. Is it, I guess, is it the understanding that even if those jurisdictions don't jump on board, we need to do this even just between the district and ourselves? You follow what I'm asking, I guess?
Yeah, I'm happy to do it with just the district and ourselves. There have been, over the past almost 2 years, there have been times when a couple of us did things that not everybody did, but it's the right thing to do. And having the district, which is probably, we share the most border with in terms of businesses, we're probably the most fluid in terms of going back and forth. For restaurants, I think that's an important partner to be tied to here.
I wanted to get back to testing. I appreciate kind of the chart with where the tests have been distributed. But to Kate's point, it's interesting, I've seen a lot of activity about people scrambling to libraries, kind of as community access points. Is there any plan for the county to kind of expand its distribution to those channels as well? Because a lot of people, they know their local library. I'm wondering, obviously you guys, as you said, have kind of distributed them through these community partners like Latino Health Initiative and many others. But in the next couple of weeks, what's kind of the mindset in terms of expanding them through libraries or other channels, I guess?
It comes down to just having enough tests where we don't feel like that we're going to put them into a library. They're going to be going in 15 minutes to the residents who are able to camp out and get the tests, right? That's what it comes down to. We've distributed 15,000 of these take-home tests for a population of 1 million people. And so obviously if we put just as I think Anne Arundel County have learned this and Baltimore City learned it yesterday, the interest in these kits is extremely high. And what happens is they become a wanted commodity, and the people who have the most access to take time off from work, to go, sit in front of a library, to, drive over, are the ones who end up getting the kits. And that's not necessarily the people who A, are at the most risk, or B, don't have other means to acquire test kits if they were inclined to. And so these should be ubiquitously available. Every American should have access to rapid testing kits, 100%. But until we have enough test kits to sustain giving them out through a library first, for everyone who wants one, we've prioritized focusing on places where we know people are at greater risk of exposure. We know people aren't going to have other means to receive or acquire testing. So it's really been about a prioritization. We've done this through our vaccination efforts with an equity standard. That's really what we're talking about here, is making sure that people have access to it. We will assuredly grow into having libraries and other places where they are ubiquitously available, just as we did through vaccine rollouts. But we want to make sure that we have enough kits where it doesn't just become the most able among us are able to camp out a library and get a kit.
Right. I guess on that point, you know, you mentioned other providers outside the county providing testing, especially the rapid test kits. I don't want to knock all the efforts you're doing necessarily, but do you think, you know, residents have a better time right now going to pharmacies or purchasing them through the private market? I know that it's kind of a loaded question, but what are your thoughts on the private versus public sector in terms of accessing tests at this point?
Look, I've heard from people who've talked about going to multiple stores and not being able to find the kit in the store. I think it kind of just fluctuates. I mean, sometimes they've got kits, sometimes they don't have kits. And they're probably like us. It's a constrained supply chain. I was just looking at a, no offense, Baltimore Sun story today or yesterday that talked about, you know, the scramble for kits and the difficulty people are having in finding them. There just are not enough kits that got produced.
To borrow a phrase from Tom Fitzgerald, this one's out of left field, but in October, I talked to Oscar Menza about the Afghan refugee situation, especially since in September that was top of mind for a lot of people. And my understanding is that there were 37 to 38 kind of refugees at the Bethesda Hyatt. A report came out, which I emailed you all. I'm not sure if you had a chance to see it, but I'm wondering, number one, if the refugees are still there, just all of your perspective on the logistical issues. You know, it's been a bit of time. And my understanding of my conversation with Oscar was that the idea was the hotel was a holding point, and to get them as the resettlement agencies eventually. I know it's kind of long-winded, but I'm just looking to see what the logistical issues here at this point are in terms of getting these refugees kind of assimilated is probably not the right word, but, you know, further connected in the community. And if that's for anyone who has any knowledge of that.
Look, Steve, they're getting treatment, and it is, you know, if you think about it, it's the closest place for them in order to have access to the treatments they're getting. You know, these are the people that supported us and had to leave their country, because they supported us and actually helped us, more than supported, worked for us and helped us. And so I don't understand anybody who's got an issue with them, you know, being, God forbid, in a hotel here while they get hospital care after what these folks have been through on our behalf. So I know they're there. Doesn't bother me that they're there. I haven't heard any complaints about, you know, them having any negative impact on anything. And when their treatments are done, I'm sure the resettlement agencies are going to work to relocate them.
Okay, so to clarify, it's just they're still getting health treatment, I guess, or because it's been 2 months.
Absolutely, Steve.
Go ahead.
Yeah.
Absolutely. And as Mr. Elrich said, we've had conversations as part of our Afghan parolee task force here at Health and Human Services, and some of Sean's team in public health and emergency preparedness have been working with them. We've also had our maternal and child health program provide support to them. We've had conversations with the Maryland Department of Health to assure that they have adequate and sufficient health care as we transition them into the country, into permanent spaces. So they are provided with updates on a daily basis and assessed on a daily basis regarding their needs. And we have weekly conversations with Dr. Menza and his team regarding their particular needs, and as well as what other jurisdictions are doing to support this effort.
Is there a timeline?
Steve, we have another question. We'll loop back to you. Okay.
Okay.
All right. Jenna, we have a question from Jenna from the Washington Post.
Hi there. Thanks for taking my question. When it comes to proof of vaccination, I'm curious a little more about that. If testing would be an alternative under the county executive's plan, and if religious services will be included. And then finally, beyond the regional sort of aspect and sort of the competitive or pushing customers kind of around the region question, can you give me a flavor of other complaints businesses or concerns businesses might have had when it comes to this proposal?
Well, I met with the lobbyists, and I guess two of them, and the issue is, are we going to need extra people? Our people don't want to confront customers who may not want to be vaccinated. I mean, I get that, but it doesn't give them the right to come into places and make other people sick, and it doesn't give the restaurants a pass, and they need to acknowledge that they occupy a space through no fault of their own where people are just more at risk. I'm not blaming them for being in this space, but the fact is, this is not a good space to be in. And I've been in plenty of venues where they required vaccines to get in. And I've stood in line very briefly. You walk up to an employee, they say, show me your driver's license and your vaccine card, which they tell you to have out when you get there. So you just walk up to them, you show them the vaccine card and the driver's license. They verify the names are the same, they let you go. It is not an inquisition. It doesn't take any time. No place I've been at has it seemed like they were getting just a giant bottleneck at the door. So I don't buy it. They may lose some customers, the few adults who aren't vaccinated. Maybe not being able to do things like go to a restaurant will finally get through to some people that if they would like a normal life like the rest of us would, they can go get vaccinated. But the more people spread this and the more this stays out there, all of us are deprived of a return to normalcy. And I think Hogan said it really well. 9% of the people occupying, 75% of the hospital beds, that's just not right. It's not right at all. And they need to deal with it.
Yeah, a few of the other questions, they were largely operational. So they're thinking about like, well, what if it's a food court where the restaurant who's selling the food isn't necessarily where they're going to be sitting? There were really nuanced questions that were being raised by some of the partners that we're going to look through and figure out reasonable answers to and try and make sure that they're reflected within. And they were also asking like, what scrutiny are we going to have to apply to the documents to make sure, we've all heard reports of people utilizing fake vaccine cards like that. The NFL has had that issue as well. So there was some questions about that would they be, would there be liability for a business or would they be fined if they allowed someone in with a fake card? That's the kind of questions they were asking that we can, help provide clarity on, both in terms of what goes into the bill, but also we would obviously associate with that some guidance or training that would allow them to understand exactly what their business responsibilities were. And, if we're going to enforce it or how we're going to enforce it, what would be the things that they could get in trouble for doing in the enforcement? That's really the questions that largely we got. There were some philosophical questions about why or what the intent was and things like that. But obviously, I think everyone understands what the general principles are at this point because there have been so many passport programs and implemented across the country. I know just in the last, 48 hours, I think the mayor of Baltimore talked about asking his health officer to design a passport bill this morning. Chicago just announced they're implementing. Boston last week. Philadelphia just did it. So this is a process that's proliferating across the country, particularly around urban centers where we know that they tend to be more heavily hit with rapid increases or the speed of increases tends to be higher in those places. And so obviously we're certainly a more urbanized area in the country relative to many parts of other places. So that's obviously gives you a sense of the intent behind why we would do this. And obviously, the comment that I think we have gotten most is, well, Montgomery County is so heavily vaccinated. Why do this? And as kind of executive alluded to, we have business and we have people coming from other places. We have a lot of federal officials who live and work and bring guests into Montgomery County. We want to make sure that our residents are kept safe by people who are not necessarily from Montgomery County and from the small portion of our county residents who are not vaccinated. So all of those things combined to just make it, particularly when there's a regional partner that's doing it already, we don't want, as the county executive said, the unvaccinated DC residents deciding that Montgomery County is attractive alternative to come to, because that doesn't help our situation at all.
Okay, I don't see any more questions in the chat.
Barry, can I just ask the one
Sure.
follow-up on the refugee?
Sorry, thank you, Steve.
No,
Go ahead.
no worries, Barry. Have any of you gotten a sense from state officials or the resettlement agencies, to your point, the health treatment going on at the hotel, that's what's going on right now, but eventually I imagine the goal is to eventually get these people resettled in more permanent housing or through the agencies. Is there been any clarity from the state on a timetable there, I guess?
I can tell you that there have been more than one cohort that's come through. So they have cycled out some of the medically fragile patients who were there, because I know we've been asked to go back for new cohorts. And that,
Do you know roughly how big that is, Sean? How many people that was?
I don't want to misrepresent it, so I'd have to look that up with our team.
Okay, because I assume it's hundreds of people have come through this hotel. I just want to verify that simple fact, right? I'm not getting that wrong.
Again, I would have to check.
Yeah.
I know it is the medically fragile individuals who need treatment and their immediate family who are with them, obviously. So that the number is a little bit higher than, of course, just the patients who need care. But I would have to check with our immunizations team, who's been going out and providing support to them.
Thank you, everyone.
I do have a follow-up question from Kate Ryan. Kate?
Thank you so much. I appreciate it. And this one is also off topic, but I did want to get County Executive your thoughts on this. The apparent murder on Wisconsin Avenue. 3 teenagers have been arrested in this case. It's rather shocking because of the location, I think. Have you gotten a lot of feedback? And what I mean is right on Wisconsin Avenue in the evening, involving 3 very young people. Are you getting much feedback, and what are police able to tell you about, just the general outlook in violent crimes like this one?
We know who's involved. We have an idea of what this was about. It's kind of hard to say, well, it's shocking because it happened on Wisconsin Avenue, but somehow less shocking when it happens anyplace. I mean, I find all of it disturbing. There's no good place or no preferable place to do this kind of stuff. And I'm sure everybody in any community gets concerned with when they see incidents like this. I will say it continues a pattern where most of what we've seen is person-on-person violence by people who know each other, and are literally dealing with each other in some cases. But it's something that we're addressing. We're continuing to. We've had discussions about this in Silver Spring. Our officers are aware of it. We've been unambiguous that we expect them to, patrol and to make sure they're doing what we expect them to do when they're out there. But, it's hard to blame this on, anybody other than 2 people figured out a place to meet. And in probably a very quick time, the thing went south. And I wouldn't expect that, the people patrolling in Bethesda would necessarily have been standing on that corner or parked in front of that building at the moment that things went down. But the fact that they arrested 3 people pretty quickly tells you that they're out there and they're on the job, and they're making sure that we try to bring anybody who commits a crime, to justice here.
Thank you. I appreciate it. Thanks.
And our last question here is from Bruce DePoit, Maryland Matters.
Thank you. Thanks for doing this. And my apologies if this question has been covered. County Executive Olszewski had a press conference Monday with medical leaders. Gail Cunningham, Chief Medical Officer at University of Maryland, St. Joseph Medical Center, said that the staffing challenge and the patient surge have combined to produce what she called a health crisis in Maryland. And she said, I would recommend mandating masks again. Do any of the speakers on the call have any thoughts? Thank you.
She's right. That's my thought. It's pretty clear. I've talked to the hospitals, and they've told me horror stories of, they're losing nurses, and a lot of them they're losing to become traveling nurses. And as one hospital head said to me, if we hire what they call traveling nurses to replace these positions, they are paying $10,000 a week. And it's really hard for a regular nurse who's, making $90,000 a year doing the same thing as somebody who's making $10,000 a week, working next to that person and not feeling like, why am I in this situation? Why don't I just become a traveling nurse? So just the economics of this, I think, have further destabilized that, the supply of nurses. You've got people, who we wore people out. It would be hard to come up with a group of people who were simultaneously put through more pressure for a longer period than anyone else, and then endured massive amounts of abuse from people because they were symbolic of the effort to fight what some people thought was an imaginary disease overhyped by people intent on putting chips in your arm. You do that kind of work and you don't feel appreciated, and you put your life at risk, and many frontline health workers lost their lives in this, and here they are staring at yet another surge. And across the country, people are still resisting getting vaccinated and doing the right thing. It might be hard to recruit people in a situation like that. And we find it in other jobs where if we're asking somebody to do something that's front facing, people kind of equate front facing with putting yourself in a dangerous situation. And if you don't feel respected and you don't feel fairly paid, or you just are tired, it's hard to recruit. And we need,
And on the broader mask mandate issue.
I think people should be masked. Well, we should go back to masking. Certainly anytime you're around people, whether it's crowds indoors or crowds outdoors. I've talked to people who think that, their contact was eating with somebody outdoors. So my perception would be, wearing a mask as much as possible would be a good thing. I never saw it as harmful. I never felt like my life was eroded by it. Did I love it? And did I think like this is the most pleasant thing I've ever done? No. But did I feel like, this has to end or my life isn't going to be worth anything? I didn't feel that either. It was an inconvenience, but it was an inconvenience that kept everybody safe. I can live with that. Most of us can live with that.
So
Thank you.
just to add, Bruce, I think, so obviously there is a mask mandate in Montgomery County, indoor mask mandate. We are, at the request of Dr. Bridgers, we are going to brief the county council sitting as the Board of Health in early January prior to them having reached the trigger point that would remove the mask mandate, to give them a briefing about the current situation in Montgomery County with regards to cases, case rates, hospitalizations, and the like. At that point, I would expect that our recommendation would largely be that they should not be removing a mask mandate in the middle of a case rate in the thousands and a rapidly escalating number of hospitalizations. And I think that is not an imprudent thing. I'm generally supportive of having a roadmap to how we get out of this repetitive cycle of having to implement these provisions. But unfortunately, COVID seems not too inclined to have such an easy roadmap for us. Omicron was not a consideration when the council put in place the regulation around the 85% vaccination rate. And that number may not be relevant to the conversation now that Omicron is the dominant strain in the United States. And so we're going to review with them the data. We will absolutely make a recommendation. I would expect that recommendation to essentially entail, don't remove the masks right now, and let's reevaluate along the timeline that DC has proposed as an example, which is the end of January. as I think I alluded to last week, this rise may not be as long as our previous waves. That is evidence that is emerging in South Africa, where they're on the decline again. And so if that's the case, then maybe we can revisit that decision in a matter of weeks, not months, and be able to have that more informed conversation. But removing face coverings or masks in the middle of a rapidly escalating number of cases and hospitalizations just doesn't make a whole lot of sense.
No, I agree. Bruce, and just one thing to add to what Dr. Stoddard said, the past 22 months, we've stayed ahead. It's been about 13 or 14 variants of this virus, and we will continue to make those recommendations to stay ahead, as he indicated, not specifically identifying any date, but knowing and realizing based on the data that we review and discuss and research on a daily basis deep into the evening, that there needs to be an ongoing or a continuance of those protective measures that we have in place.
So, two things I just would add to this. One is people keep trying to compare this to the flu, and it's made worse when people say you're just going to get a cold. Our deaths in any month have been higher than flu deaths for a year. So this is not hardly just like the flu. And it's not just like the flu at this point, otherwise our hospitals wouldn't be full. The other thing is, people will say, oh, you're going to move the goalposts again. I think people need to realize, this whole thing is, this in particular is based on a notion of herd immunity, which is this virus is made absolutely irrelevant. It's not like, it's hoof and mouth disease. And, if so many people, so many animals have been infected and there's no place for it to go, and it's the same thing year after year. How many times has COVID changed? This is not a case of moving goalposts. This is as if COVID just puts a new team on the field and says, we're playing a different game now. So the first virus was not Delta, and Delta is not Omicron. And so we're dealing with something that's changed and fundamentally changed the game. We thought we were going to be okay with 2 doses, and then we thought, okay, 2 doses and a booster, but there was no urgency conveyed, by a lot of folks about you need to get this booster. Now we're realizing the booster pushes people back to the levels of immunity they likely had when they had their first 2 doses of COVID and it was fresh. And so just people have to accept the fact that this is a thing that is affecting us that changes. And every time it changes, it creates a different set of problems. And we have to respond to the problems that it's handing us, not to some theoretical notions of herd immunity or similarity to the flu. All that does is, I think, disappoint people and keeps them from realizing the severity of what it is we're dealing with.
Okay. I believe that is our last question. I'll do the typical drill, going once, going twice, going 3 times. Want to thank everyone for joining us. Thank you, County Executive, for assembling us again another week. Want to wish everyone on the call and those at home a happy holidays and merry season. Be safe. If you haven't been vaccinated, please do so. If you've been vaccinated once, get your second shot. If you have gotten it twice, get your booster, and make sure you get tested. Thank you very much, and we'll see you all probably next week.
Thank you so much.
Thank you all, and be well.
Yeah, happy holidays, everybody.
Happy holidays.